Hello, my name is Evangelos Sdogkos, and on behalf of our team, I would like to thank the organizing committee for the honorable acceptance of our abstract, which is entitled Night Smoking as a Factor of Tobacco Dependence and Prognostic Marker for Treatment Outcomes. Waking at night for smoking is a usual behavior among smokers. It may be associated with poor treatment outcomes at 6 months follow-up, and this was our hypothesis for our work. Aim of the study was the identification of the factors associated with night smoking, and on the other hand, the assessment of smoking cessation treatment outcomes. As for the methods, a total of 653 cigarette smokers who received treatment at our Smoking Cessation Counseling Center were studied. Clinical history, risk factors, and smoking habits were collected from their medical records. By a structured questionnaire, included the Fagerstrom test, information about nicotine dependence was obtained. All participants were followed up for 6 months after their target quit date. According to their smoking relapse, the participants divided into those who managed to stop smoking, and we call them quitters, and those who didn't, and this was the non-quitters group. As for the results, the mean age of the study population was 58 years old. 3/4 of them were males. A Fagerstrom test score over 8, which indicates a strong dependence from nicotine, had 62.6% of the population. Regarding their medical history, 34% of them had hypertension, 30% dyslipidemia, and 17.5% diabetes mellitus, while their mean body mass index was 26.8 kilograms per square meter. About half of them, 49.5%, had a history of vascular disease, and approximately 20% of them had also respiratory problems, and specifically chronic obstructive pulmonary disease. 9% of the participants reported that they used antidepressants drugs. Regarding their smoking habits, night smokers reported about half of them, 49.8%, and smoking abstinence at 6 months follow-up, that means the quitters group, was only 32.9%. Regarding the factors associated with night smoking, we noticed that a large amount of smoking cigarettes over 30 per day, as well as use of antidepressants, history of vascular disease and stroke, or COPD, Fagerstrom test score over 8, and lower socioeconomic status were statistically significant factors associated with night smoking. For the assessment of smoking cessation treatment outcomes, beyond night smoking, the age over 25 years, age of first cigarette over 25 years, and the number of cigarettes per day over 25 were statistically significant predictors for non-quitting smoking. As for the average time to relapse, night smokers reported a shorter time, 42 days versus 63 days, who had the non-night smokers group. And a few words about the discussion. It is worth noting that there are no existing definitions of night smokers. Night smoking had the form of a predominantly male-only social event in the late 19th and early 20th centuries, beginning in Australia. We considered as night smokers those who report night smoking at least once a week. Night smokers may wake at night due to dropping nicotine levels, but they may have sleep disorders due to factors other than nicotine dependence, such as primary insomnia, depression, or perceived stress. And we must not forget this when we were called to advise these patients. As for the Fagerstrom test score, a high score beyond nicotine dependence can be a prognostic factor for outcomes in COPD or CAD. And this shows the strong relationship between nicotine and cardiorespiratory diseases. And finally, the results of our study are compatible with other studies in the literature. In conclusion, night smoking is a significant indicator of nicotine dependence and a marker of more intensive and sustained treatment for smoking cessation. This behavior, associated with several socioeconomic and tobacco characteristics, can be easily assessed. And with this, I would like to thank you for your attention.